Hello, my name is Toby. Thanks for everybody's coming. So today we're just having a little presentation about HIV and AIDS. We want to talk about what is HIV and what's AIDS. So what I do is I create a PowerPoint here. So let's talk about 3H of what's the 3H of HIV and AIDS. So exploring the critical end aspect of HIV and AIDS. And then, so the first thing we are introduced thing is about how how do people get HIV and AIDS? So understanding HIV is a virus that attack the immune system, making the body vulnerable and infected with the diseases. And transition to AIDS, which when HIV transition to AIDS, that's gonna be very critical because when it's come to turn into the AIDS, that sort of is just like last resort. And if untreated, then that will be progressed to AIDS, then that person might die. And then importance of an early detection. So you normally just start to do testing regularly if you are, frequenting with people like frequency have a lot of sex or not protect sex, or maybe using sharing meals and stuff. You gotta make sure you test regularly, and that's how the HIV. And then with HIV, with the prevention, recent data indicated millions are living with HIV globally, and highlighting the importance of awareness and education. Not everybody knows about it, so that's what we're doing this workshop. And health impact. Living with HIV at the moment is better now than before because now a lot of medications now can help people diagnosed with HIV live a really good life. And then with the social economic effects, which impact with the HIV extended beyond health and affecting maybe their job, education, families, and expect. So that's a global statistic and impact. And then with combating the stigma, education plays a critical role in reducing the stigma associated with HIV and promoting understanding and empathy for people. It is now is better to compare back in the 80s when it first happened. I did remember vaguely in the 80s the commercial ad in Australian commercial about AIDS, which I think was very daunting. It's about the Grim Reaper and came out and slaughtered all those people. So I vaguely remember the commercial back in the 80s. So of course we're promoting testing, so awareness of regular testing so you people will know like what's going on. Like same as your health check, do a regular health check and you'll know what's going on with your health and everything and encouraging and preventive measures. Of course, we encouraging educating people, safe sex protection, also not sharing the needles and stuff like that to prevent for any transmitted in the bloodstream and transmitted with HIV. So that's why the importance of education awareness. The next HIV is called human immune deficiency virus. Two species of Leyden that infects human. AIDS is meaning acquired immune deficiency and syndrome, which is the final stage of the infection. There isn't a cure for HIV yet, but there is an excellent treatment for people to live a long life. If you are diagnosed with HIV and you take can your medication, you can have a very long, healthy life like everyone else. So that is what with HIV and AIDS is all about. And we want to look into what is attacking, how to come with. The definition of viral load, which the vital load refers to the quantity of HIV present in an individual, the bloodstream used to elevate the scenario of the infection. Treatment effectiveness, monitoring the viral load, so with your blood cell and shell, and it could assist the effectiveness with HIV treatment. And then transmission risk, understanding viral load level help you determine the risk of the treatment. and the risk of how bad it is. Because some of the people have HIV, but they are undetected. So they still have the HIV virus, but they're not easily to transmit to someone else. So the vital law. And the next, immune system health. The CD4 count is critical indicator of immune system health, reflecting the body ability to fight infection. So early stage of HIV, people think it's like a common cold back in the day till all the other symptoms start to come across and people start panicking. And Dominican for the higher counts, a higher CD4 count generally indicate a better immune function, which initial for the overall health. Impact and implication of a low count. The low CD4 count may signify advance of HIV disease and increase vulnerability for infection. That's what the CD4 count. With HIV was preventive treatment, of course, make sure to take drugs, and with the PrEP, it's unaffected preventive treatment, which is specifically designed for the individual of a high risk for HIV infection. So similar like was the drug we prevent pregnancy? Right. Yes, no. A for contraception pill. So similar to that in a way to help people taking the PrEP. So you have a low risk of getting HIV, but it's not 100%, but you're on the low risk side. And of course, the risk is reduced for the infection. That's the drugs for, but not 100%. And then that's called a pre-exposure, so we short for PrEP. And then a post-exposure PEP, which is mean that's for people exposed with people had HIV within 72 hours. They can request with their local hospital for this PEP to get the medication to take. I think it's 3 to a week. So what is PEP stand for, which is involved taking the medication after potentially exposed to HIV. So if that ever occur, call your local hospital, they give you medication, but that has a short period of time within 72 hours. If over 72 hours, you might have to get tested, make sure everything's clear. If you do test positive for HIV, that means you will have to seek further treatments and everything. The time is crucial, 72 hours, and then there's a lot of preventive tools for safe sex and to take PrEP, but again, all those prevention is still not 100%. The next school of HIV, so some groups of people are affected by HIV more than others, but it can pass on to everyone. Everybody can have HIV and AIDS. Getting regular tested for HIV if you are sexually active and using condom and never sharing meals and taking your medication if you're living with HIV. PrEP and antiviral medicine is taken by a person who does not have HIV, so that can lower the chances to infection. And then PEP is antiviral medicine, and that is taken when you suspect you might have infected with someone with HIV in 72 hours. Importance of confidentiality. So of course, that's whoever had tested HIV, that's their business, not our business. We still gotta treat everybody at this health clinic all equally the same. And with the confidentiality, initial individual with people affected with HIV and AIDS is still allowing to seek care and for job, education, everything. So role of privacy law, privacy is important for everybody. Like we are work together and we have a lot of patients, so privacy is something we have to thrive for. So we gotta say no to discrimination. Protection that in healthcare, anti-discrimination law ensure that individual with HIV will receive treatment no matter what. And then of course employment right, like if they have HIV or either way, but this will still get equal treatment with us. And stigma and discrimination, barriers to HIV prevention, of course. Now we're trying to give out more education about people that live with HIV or try to give out people HIV. It's not a death sentence. And the impact of treatment, of course, back in the day, I don't know if you know, Princess Diana went to the local hospital to visit those people diagnosed with AIDS and HIV. All the nurses and doctor, there's a picture of her barehanded, hold hand, shake hand with the HIV and AIDS patient. So she knows she was educated. It can't be transmitted by touch, had to be bloodstream or fluid, body fluid. So that's a really importance of inclusivity to know what is right, what is wrong, and everybody's equally the same. And of course, ethical with the impact. We got to be fair and across all treatment and monitoring the ethical standard. Here they have our global health hub. All individuals deserve the equal treatment opportunity, healthcare, disability, healthcare across and lead to worsen the health outcomes. So everybody has opportunity to see any cures at all. Doesn't matter if the disability is or anything. We gotta treat them all equally. Impact or marginalization. So marginalization with the economic communities often face significant barriers to healthcare, which can assist in healthcare issues and reduce quality of life. Very, very tongue tied. Access to treatment and healthcare equality. We gotta make sure everybody do have the same rights with everyone else. And then I just want to say that's all for today. Any questions?
People that have HIV, do they live a long life?
They do actually with the medication at the moment. If like they take it really regularly and by the doctors prescribed and everything. And of course, another thing you gotta still look out for yourself, be healthy and exercise and stuff. They do can live a long life. So in UK, only just this year, they actually found some sort of medication now to stop HIV/AIDS completely. But then again, that's still a sort of pre-productions at the moment. So in the end, you never know. That could be something in the end that would be a cure in the end for people affected with HIV and AIDS. Because at the moment, not just men, people back in the day say gay men, they are more, but actually specifically globally, the children in Africa and as a woman in Africa. So not just a gay man, that's just more media portraits and everything. And that's for today. Thank you so much. Bye.